Good morning. Talking to you because you probably had your catheter removed today. You probably had your prostate surgery maybe a week ago. We took your catheter out today, and I don't want you to be disheartened. You're going to have incontinence, which means that urine's going to leak out. You're going to need to wear protection, usually a diaper or a pad, and that's okay, and that's going to get better over the next several weeks. I recommend that for this week, you just take it easy at home and start walking. I usually recommend that you start walking an hour a day to really strengthen your legs and strengthen your pelvic muscles. And about a week from today, I want you to start doing what are called Kegel exercises. Essentially, these are pelvic floor strengthening exercises that are going to help you strengthen the sphincter, the muscle that contracts the pelvic floor. Essentially, that's the same muscle that you would use if you want to stop and start your stream. So it's important that before surgery, you practice the exercise. Basically, just while you're going to the bathroom and voiding, you try to stop it and then start again and stop and start again. And that's going to help you try to localize which is the muscle that you need to use. Okay? If you have trouble in the next couple of weeks localizing that muscle, talk to us, because we can help you with a strategy called biofeedback to try to localize that muscle in a more visual way here in the office. But basically, about a week from now, I want you to start doing these exercises. You're going to try to squeeze essentially your pelvic floor as if you were holding your urine for about 2 seconds, and then release it, and then wait about 3 seconds and start again. And usually do it in sets of 10 to 15 every hour. Okay? It's not going to help you overnight. You need to do it every day, every hour, 15 to 20 times, and then slowly over the next couple of weeks, your incontinence is going to start getting better. Patients who are thin, patients who have do a lot of exercise, tend to have an earlier recovery of their urinary function, of their continence. So I strongly encourage you to exercise, and if you're overweight, try to lose some weight in the next couple months, because that's going to help you a lot. We're going to see each other in 2 months with a PSA, and if you still have severe incontinence, which today it's not as common, we can use some medications called anticholinergics. There's one called tolterodine, which we use. It increases the bladder capacity, so the bladder's a tank, right? It's going to hold more urine, and hopefully you're going to have less accidents. There are also some antidepressants that can help. Some are called imipramine or duloxetine, can help in strengthening the pelvic floor, the muscle, and increasing the capacity of the bladder in ways that we don't really understand that well, but those medicines really work. There are surgeries that can be done if patients continue to have incontinence, let's say a year after surgery. Fortunately, they're not that common nowadays, but usually between 3 and 5% of patients may need either a sling to essentially lift the pelvic floor, or rarely have what's called an artificial urinary sphincter, which is basically a cuff that's placed around the urethra so that the patient can open it and deploy it when he wants to go to the bathroom. But again, it's rare that we need to refer patients for that surgery. So hopefully your recovery is going to go great, and we're going to see each other in 2 months with your first PSA. Have a great day.